and it would cost around 40 to 60,000 Indian rupees at that time to get these exams done. So I couldn't afford it. Mentorship is everything, trust me. It's like trying to swim across a vast ocean. You are going to struggle if you don't have someone to guide you. Many IMGs think the secret sauce is high USMLE score, but it's more than that. Your application should tell a compelling story, one that highlights your unique experiences and skills. I matched into a university-affiliated program with just one US clinical experience and no publications. It's almost unheard of today. With the 2024 World Federation of Medical Education Accreditation update, the process for international medical graduates is undergoing a major shift. Residency programs are designed to be rigorous for a reason. They aim to prepare doctors for the realities of practicing medicine independently. This means long hours, overnight shifts, and a high volume of patient interactions. The number of telemedicine services and apps post-pandemic have popped up unprecedented rates. The number of telehealth visits in the US jumped from just 0.1% of medical visits in 2019 to over 40% during the first half of 2020. Welcome to WTF, We Talk Facts, the podcast where we cut through the noise and dive straight into the real challenges and opportunities in the medical field. I'm your host, Dr. Machani, an academic internal medicine physician, and alongside me, I have my co-host, Dr. Emily Surzyn, an academic hospitalist, who is here to keep me on my toes and add fresh perspectives. Today, we are going to talk about what our podcast brings to all of you. This has been a crazy journey so far up to this point, where it's time for us to give back to the medical community about important aspects in clinical and administrative medicine. This podcast will address important medical topics where clinicians are faced with difficult decision-making and guidelines don't have clear-cut recommendations, and how we can make reasonable recommendations with the help of available literature, expert opinions in that particular field. We will also talk about medical education in this era of cutting-edge healthcare industry and how it is impacting young physicians' clinical practice, and a couple other important topics of interest are residency training and IMGs in USA, something that's very close to our heart. Our journey as an international medical graduate and how that experience has shaped our career in the US medical system. Because this is our first introductory episode, we will touch briefly on topics you will see us dive deeper in the following episodes. So, let's get started.
Absolutely, Dr. Machani. I'm excited to be here and to dig into our incredible story. You've mentioned before how our path wasn't the typical route. Can you share to our listeners what your journey was like starting out?
Sure. My journey was anything but typical. I graduated from a medical school in 1995, and back then there was not many online resources or fancy test centers for USMLE. The closest center was in Singapore, and it would cost around 40 to 60,000 Indian rupees at that time to get these exams done. So I couldn't afford it, and got a bit creative with the help of my mentor and life-changing advisor, Dr. Ramnath Dukkipati, who is an academic nephrologist now at UCLA. He sponsored me to Jamaica, where I made my life, and after 13 years, with the support of my wife and my good friend, Dr. Rajshekhar Umesh, who is a hospitalist now in North Carolina, got through my USMLE journey and matched at an IM program, University of North Dakota, Fargo, and upon completion, I have been in academia until now. So what about your journey, Emily?
Wow, that's a journey many of us can hardly imagine. It sounds like it took a lot of determination and ingenuity to even get started. My journey was also unconventional. I left Canada to complete a medical program in Europe, more specifically in Poznań, Poland. This was an opportunity to learn more about my heritage and culture, as well as open my perspective to different healthcare systems. How do you think that experience has shaped your perspective on the current challenges faced by IMGs?
It has shaped it profoundly. The challenges back then were different, but the core struggle remains the same. It's about resilience, adapting to new environments, and finding your way despite the odds. Today, IMGs still face a tough road, but the landscape has changed. Now there's a lot more emphasis on networking, mentorship, and understanding the US healthcare system, which is quite different from what many IMGs were used to. It's not just about passing exams anymore. It's about proving that you can thrive in this unique environment.
That makes sense. You often talk about the importance of mentorship. Can you elaborate on why you think having a mentor is so critical for IMGs today?
Mentorship is everything, trust me. It's like trying to swim across a vast ocean. You are going to struggle if you don't have someone to guide you. During my journey, I didn't have a formal mentor, but I made it a point to learn from those around me, from their successes and failures. Today, I mentor a lot of IMGs myself, and I have seen firsthand how important it is. The process is arduous and filled with mental stress, and having a mentor can provide not just guidance but also a sense of solidarity. And let me tell you, everyone's journey is unique. You can't compare your struggle with someone else's. It's about focusing on your path and leveraging every resource you have.
Mentorship seems imperative to residency. Can you give us some insight into what residency training is like? What specific challenges do IMGs face during this period?
Residency is where the rubber meets the road. It's not just about applying what you have learned. It's about navigating a completely new system. For IMGs, one of the biggest challenges is adapting to the US style of patient care, which is heavily evidence-based. But what do you do when there are no clear guidelines? This is where clinical judgment comes in. That's something I want every IMG to understand. You need to be adaptable, think on your feet, and most importantly, be a team player.
It's not just about clinical knowledge, but also about critical thinking and collaboration. What advice would you give IMGs who are preparing their residency applications now? How can they stand out?
Great question. Many IMGs think the secret sauce is high USMLE score, but it's more than that. Your application should tell a compelling story, one that highlights your unique experiences and skills. For instance, I matched into a university-affiliated program with just one US clinical experience and no publications. It's almost unheard of today, but it's possible because I focused on my strengths and told my story well with proper guidance. It's not about having a perfect profile. It's about showing your uniqueness, your journey, and how you have overcome obstacles. And remember, a strong personal statement and solid interview performance can make all the difference.
It's so true. There's so much focus on the numbers, but it sounds like it's really about the narrative you build around your experiences. How does the current healthcare landscape affect IMGs, especially with evolving policies? More specifically, with the new ECFMG accreditation changes in 2024, what should IMGs be aware of?
That's a really important question. With the 2024 World Federation of Medical Education Accreditation update, the process for international medical graduates is undergoing a major shift. Previously, medical schools outside the US were recognized directly by the World Director of Medical Schools and required ECFMG sponsorship for certification. Now the emphasis is on accrediting national or regional agencies through WFME. If your country's national accrediting agency isn't recognized by WFME by January 2024, graduates from those schools won't be able to apply for ECFMG certification. So what should you do? First, check with WFME website to see if your country's accrediting agency is either already recognized or in the process of applying. If it's not, you still have a chance to apply for ECFMG certification under the current system before the new rules kick in. In the meantime, stay focused on acing your USMLE exams, completing your ECFMG registration, and building a strong application. It's also a good idea to push your national accrediting body to get FME recognition. Rally with other students and make your voices heard.
And then there's the USMLE journey itself, which has evolved so much over the years. Can you talk a bit about how the experience of taking the USMLE exams has changed from your time to now?
Yes, the USMLE has come a long way since my days, from a paper-based test to online testing at prometric centers. The other aspect of it is the huge financial and logistical burden. The tests have become more integrated, focusing not just on medical knowledge, but also on clinical reasoning and patient care. And with step one, going pass or fail, emphasis is shifting even more to other parts of your application. Your clinical experience, personal statement, and how you present yourself during interviews. IMGs must stay agile and adapt to these changes if they want to succeed.
Residency training is often described as the most intense and transformative period in a doctor's career. From your experience, Dr. Machani, what are the key challenges residents face today, and how can they effectively navigate these to ensure a successful career?
Residency is indeed a crucial period where theory meets practice, and there are a few key challenges that come to mind. Residency programs are designed to be rigorous for a reason. They aim to prepare doctors for the realities of practicing medicine independently. This means long hours, overnight shifts, and a high volume of patient interactions. The learning curve is steep, and residents are often thrown into situations where they must make decisions, think quickly, manage multiple patients, and make critical decisions under pressure. This can be particularly daunting for those new to the system or transitioning from different medical environments like international medical graduates. The challenge here isn't just the workload, but also the mental and emotional toll it can take. Burnout is a significant risk, and it's exacerbated by culture sometimes still glorifies toughing it out rather than seeking support. However, there's been a positive shift in recent years, with more emphasis on wellness, mental health, and support networks within residency programs. Programs are increasingly recognizing the importance of providing residents with resources for mental health, mentorship, and even structured time for rest. My advice to residents is to be proactive in seeking out these resources, whether it's counseling, peer support groups, or simply taking a breather when needed. Learning to balance work and self-care early on is crucial because burnout can negatively impact not just your well-being, but also your clinical performance and patient care.
So let's talk about some important clinical topics where residents and practicing physicians face critical decision making, where guidelines may not offer clear recommendations. How exactly do you go about this?
It's a great question. Let's talk about one such clinical situation called subclinical hypothyroidism, which is a lab diagnosis, and especially it's a bit tricky in the elderly. This condition is characterized by elevated TSH levels with normal free T4, and the decision to treat or observe can be controversial. Some guidelines suggest treatment based on the TSH levels, while others recommend monitoring. In practice, the decision often depends on the patient's overall health, symptoms, and risk factors. It's a balance between avoiding overtreatment and addressing potential risks of not treating. And again, every clinical decision should be about patient-centered care, respecting their views and discussing the benefits and risks of the treatment or intervention. This pattern should be applied to all forms of clinical decisions and not just in situations where there is no guidance.
These kinds of clinical situations are often encountered in real life practice, and clinicians need to have some guidance or knowledge about addressing them. Speaking about keeping a pulse on changes in healthcare, with the rapid evolution of the healthcare industry, especially post-pandemic, how do you see the future of patient care shaping up? I mean, what role do you think technology and policy changes will play with this transformation?
Healthcare industry has seen a seismic shift, particularly accelerated by the COVID-19 pandemic. The ones I see are telemedicine and value-based care. Telemedicine has transformed from a niche service to a mainstream necessity. The number of telemedicine services and apps post-pandemic have popped up unprecedented rates. The number of telehealth visits in the US jumped from just 0.1% of medical visits in 2019 to over 40% during the first half of 2020. Before the pandemic, there were numerous regulatory, financial, and cultural barriers that limited its adoption. But now, with the urgent need to provide care while minimizing contact, it has become an integral part of healthcare delivery. Patients have grown accustomed to the convenience, and the healthcare providers are seeing benefits in terms of efficiency and reach. But one main concern that is tied into all this is privacy and security concerns with digital health records, similar to Anthem Inc. data breaches in 2015. Secondly, there is a strong shift towards value-based care. The healthcare industry is increasingly moving away from the fee-for-service, where providers are paid based on the number of services they deliver, to a value-based model that rewards providers for quality and patient outcomes. This shift aims to reduce healthcare cost while improving care quality, which is crucial in a system as expensive and complex as the US healthcare system. The challenge here is adapting to these new metrics and ensuring that all providers, including smaller practices and IMGs, are equipped to thrive in this environment.
Medical education has seen numerous changes over the years, particularly with the integration of technology and the shift in focus towards competencies. What do you believe are the most significant changes, and how should current medical students and IMGs prepare for these evolving landscapes?
Medical education is indeed undergoing a transformative phase, and I would highlight two significant changes: the competency-based medical education model and the integration of artificial intelligence in learning and practice. First, the CBME model has fundamentally altered how medical education is structured. Instead of the traditional time-based progression, CBME focuses on the attainment of specific competencies and skills. This shift requires students to demonstrate their ability in areas such as patient communication, clinical judgment, and procedural skills before moving forward. For IMGs, this is both an opportunity and a challenge. They need to understand that simply memorizing facts won't suffice. They must develop a comprehensive skill set that meets these competencies. This approach can be advantageous because it emphasizes mastery. It also demands adaptability and a willingness to engage deeply with both the clinical and non-clinical aspects of medicine. The second major change is the integration of artificial intelligence and machine learning into medical education and practice. From diagnostic tools that use AI to interpret learning or imaging studies to algorithms that can predict patient outcomes, technology is becoming a critical part of the medical toolkit. Medical students and IMGs need to be comfortable using these technologies and understanding their limitations. It's not about replacing human judgment, but enhancing it. AI has immense implications for the medical industry, and it's just the beginning. I often say, it's not here to replace the physicians, but physicians who don't adapt to AI will definitely lag behind compared to ones who do. We will be going deep into this subject in our upcoming episodes, so keep an eye out.
That's a great point. It's clear that success in this field requires a combination of adaptability, perseverance, and a solid support system. As we wrap up, do you have any final thoughts or advice for our listeners?
Yes, I want to emphasize this. Don't get discouraged by the process. Every IMG's journey is different, and there is no one-size-fits-all approach. It's about finding what works for you, getting the right mentorship, and keeping your eyes on the prize. Remember, your credentials will get you an interview, but your personality, your ability to connect, and your performance in that interview will get you the job. So, keep working hard, stay focused, and don't be afraid to seek help. Good luck to all of you out there. and I hope to see many of you succeed.
Thank you, Dr. Machani, for sharing your wisdom and experiences. This has been an enlightening discussion, and I'm sure our listeners will take a lot away from it.
Thank you to all our listeners. Thank you for turning into WTF, We Talk Facts. We'll see you in the next episode with more insights and real talk about the landscape of the medical field.